Well, this is a busy time for the folks at Doctors Hospital. Of course, you know we're in Breast Cancer Awareness Month. We've been talking about breast cancer here. And then next month, November, Doctors Hospital will be opening its freestanding ER in Evans. We're going to talk about all of this with Dr. James Bardoner, who is a general surgeon at Doctors Hospital. And it's great to have you here with us today.
Thank you for having me. I appreciate it.
Well, absolutely. I appreciate your time. You know, one of the things that we're going to start with is just a real general question, and it's one that we can't ignore. What can we do to lower the risk for breast cancer?
Yeah, so the sad truth about life in America is about 1 in 8 women in the U.S. is going to be diagnosed with breast cancer at some point in her life. So we focus on, I call it living healthy, but studies have shown that actually just being physically active, regular exercise decreases the risk of breast cancer. Eating a healthy diet that's low in fat and sugar, obviously avoiding smoking or even excess alcohol consumption. So more than 1 alcoholic drink per day has been shown to increase the risk of breast cancer.
Really?
Yeah.
Really? You know, just a personal question. My mother was diagnosed when she was 87. And you know, for so many years, I didn't have breast cancer in my family history, but suddenly I do. Do you think it's something that if your mother is diagnosed really late in life, is it something to be as aware of?
It's still important to be aware of it. When we do see breast cancer, it's most often diagnosed in women in their late 60s, 70s, early 80s. That's kind of the highest risk time frame.
Really? Okay.
Is usually, the typical breast cancer, which we would call a luminal breast cancer, that's the most common kind, and it is usually diagnosed earlier. Or sorry, excuse me, it's usually diagnosed later.
Yeah.
But we are seeing a trend towards other types of breast cancer being diagnosed at younger ages, and so that's where we really stress kind of the importance of an active lifestyle, especially for women in their 50s. That's not a typical age range unless there are other factors at play.
Okay, okay. So when you talk about the different ages where you see it, when do women need to start getting mammograms? It changes, and
I
changes
know.
what different groups say, different organizations.
There are so many different organizations, and basically it comes down to how much you care about cost and how much you care about catching cancer. So that I recommend that every woman starts at age 40 with mammograms. It's up for debate whether you should do them every year or every 2 years. The most aggressive guidelines would say start at age 40 and get one every year. And so that's what I recommend for women if they have any concerns. If there is no family history, someone who's healthy, good lifestyle, then I'm comfortable with starting at age 40, but every 2 years until they get to 45. And then I switch over to every year from then until age 74. And then at 74, it's more selective based on your health.
Right.
And then we would adjust that a little bit if there's any strong family history, especially if somebody was diagnosed early, then we would start early.
Yeah, that surely makes a lot of sense. You know, breast cancer does not always present with a lump.
That's true.
What are some of the symptoms to watch for?
Yeah, so a lump obviously would be a red flag. Not every lump is a cancer, but it does need to be checked. But also if you see skin changes, if you see nipple discharge, if you see swelling or just enlargement of the breast overall, that can be a concerning finding. If it's just on the one side, then that definitely needs to be checked. Okay,
all right, that's very important. Are there specific risk factors that make some women more susceptible?
Yeah, so there's the controllable risk factors we talked about earlier,
the
being active, lifestyle, but there are some things you can't control. So actually being tall is a risk factor for breast cancer.
Oh, wow.
Starting menses early is a risk factor for breast cancer. Genetics play a role in it, and your family history. And so those are things that you can't control that. But the thing you can control, again, is lifestyle and then being screened. And just making sure that you're getting in with someone who's assessing your health, assessing your lifetime risk overall. There are actually calculators where we can plug in a lot of different data points to come up with an estimate of your risk of breast cancer, your personalized risk of breast cancer from now until age 75. And so we screen differently depending on how high your risk is.
And I think that what we want women to leave this segment feeling is that knowledge is power. Don't be afraid to get screened.
I agree. Yeah, it's something that if we can catch it early, it's a very manageable disease that it's likely going to be dealt with probably with surgery and a lower chance of requiring chemo as long as we can catch it when it's early and hasn't spread. So the most important thing I tell people is, you are important, your health matters, and so it may be inconvenient to find time in your schedule to go in for a mammogram, but that is the mainstay of breast cancer screening in the U.S. is just making time at least once a year to go in and get your mammogram.
So we certainly want to encourage that. We also want to make you aware before we wrap our time with Dr. Bardoner that the new doctor's ER is going to be opening in November in Evans. We're not talking a prompt care here.
No, so this is more than just like an urgent care, prompt care. Anything that you would go to a regular ER attached to the hospital, you can also go to the freestanding ER in Evans. There's a seamless admission process if you do have to be admitted or have surgery or anything else that would typically happen at a established hospital.
Yeah.
You can also go to the freestanding ER for that.
So what you're saying there, if it is streamlined, then you're not going to feel like you're just duplicating everything all over again once
Correct.
you do get to the hospital.
Yeah, I see a lot of people who started in urgent care with something like abdominal pain, then they get transferred to the hospital for appendicitis, say, and they have to get that same workup done all over again before they can get into the hospital. And this is all seamless. So
that's really exciting. You know, it has to sink in. But Columbia County will have an emergency room. So I love that. Yeah. And I thank you, Dr. Bardoner, for being here with us today.
Thank you for having me. If
you want more information about anything that we've talked about, all you need to do is contact Doctors Hospital. They're located at 3651 Wheeler Road in Augusta. The phone number is 706-651-3232, or just go to the website doctors-hospital.net. A local writer told me recently, she's a Mohawk in high heels. You've got to meet Rebecca Harper. So I did just that. And now I want you to meet her too. Dr. Harper is a walking whirlwind of color and texture, information and ideas. And she's shaping writers and future teachers here and across the country. You'll meet her after the break.